Making the decision to work in the medical field is no easy one. Before a doctor or nurse is sent to the examination room, they must go to school and get real-life experience. Today, technology has helped create some amazing and yet horrifying tools to get them ready. Here are 10 shocking modern medical training tools. Before we get the gloves on, head on over to the subscribe button and give that thing a click. Standardized patience. Have you ever had a doctor or nurse that was a jerk to you? Medical schools all over the United States are trying to solve that issue by using standardized patients, also known as actors, that teach medical students how to empathize with their patients. Each program partners with a department in the medical school, gives the actor the scenario, and the medical student has to make the patient feel like they're comfortable and they're being listened to. Each scenario varies, but they all have a common goal. Synthetic canines. Before we show you the people, we're going to show you the animals. Veterinary training programs will use synthetic dogs so they can practice administering IVs, surgical procedures, and handling a dog. This is much easier and safer than using a real dog or even a cadaver. However, one can't deny that the lifelike cadavers with no fur or skin is what nightmares are made of. Catheter mannequin. Nurses play an important role in doctors' offices, hospitals, and intensive care units. They will usually perform tests and examinations before the doctor comes in, and they will do some of the more complex tasks like inserting catheters. Doing this on a living human body for the first time isn't ideal, as there is a trick of the hand that comes with experience. Enter the nursing mannequin. With lifelike genitals that can be switched out to male or female, this mannequin will give nurses plenty of chances to perfect their insertion skills. Dental practice heads. You wouldn't want to be the first set of teeth your dentist has ever touched, and it would be quite irresponsible of the dental school your dentist came from. These horrifying dental practice heads give dentists and their assistants the chance to examine, touch, and scrape teeth without having to worry about injuring their patients. Still, the creators of these practice heads must have gotten their inspiration from bad, made-for-TV horror movies. Synthetic cadavers. Before synthetic cadavers came around, medical schools had to resort to grave robbing and hoping that someone would donate their body to science in order to get a real body. Getting a chance to examine the innards of a human body is crucial to learning anatomy and how different organs work. Cadavers aren't the greatest thing to work with either because they smell, and it's just plain disturbing working on someone who used to be alive. This is probably why synthetic cadavers have taken off, and they're made to feel lifelike, meaning the innards are just as gooey as the real insides of a human body. Geriatric mannequin. Working with the elderly is no easy task, as their bodies are much different from the body of a younger person. Therefore, geriatric mannequins are incredibly useful, as it gives the medical practitioners a chance to handle the fragility of an elderly body without the risk of causing more harm. Prostate simulators. For many males, getting your prostate checked eventually becomes a regular occurrence during a doctor's visit, and they are important when it comes to catching prostate cancer early. Because medical students can't really keep using a real human to practice their prostate exams, prostate simulators have been created as a substitute. They are kind of hilarious to look at since they're just a butt with a hole in it. Inside the simulator where you stick your finger in, it feels lifelike, and the insides are switched out so the student will know what a healthy prostate feels like and what feels off. Delivery room simulators. Delivering babies is one of the most dramatic parts of working in a maternity ward. However, decisions have to be made on the spot should something go wrong. That is why so many medical schools are using delivery room simulators where the students have to deliver a mannequin's baby safely. From inserting IVs to dilating cervixes and even pulling a lifelike infant out, the experience should be enough to give students a realistic view of baby delivery. Amputation simulator. Sometimes doctors must perform amputations to save a patient's life and help them get a chance at a better way of living. While it's not ideal, amputations happen. But it's more than just cutting flesh. There are veins, there are muscles, and oh, there are bones. It's not a smooth cut, but instead, doctors must go about their amputations gently so they're clean and can heal efficiently. Amputation simulators give doctors the practice they need so that when they are faced with the real deal, they'll already be prepared. Robotic mannequins. Take all those horrifying simulators and mannequins we've introduced to you, and now let's make them move! Robotic mannequins, despite being terrifying and something out of a sci-fi movie, are crucial in training doctors and nurses to handle patients that either won't stop moving or can't control their movements. The primary company that makes these things is called Syndaver, and their clientele is pretty impressive, and it includes Mythbusters. Now that you have enough nightmares to last you for a few months, let us know what you think in the comments and give the video a like. See you next time!